Judy, there's been an almost unprecedented onslaught against you. Multiple articles in the mainstream press, from the Washington Post to Forbes, have come out to attack you in the segment of the film Plandemic that you appeared in. I want to separate your story from the film itself, as the two have been conflated. I want to start just by asking Mr. Kennedy, you recently wrote the introduction to Judy's book, Plague of Corruption, and in that you placed her in a long line of dissident scientists, from Rachel Carson, who discovered the dangers of DDT, to Alice Stewart, who found that x-rays during pregnancy led to carcinomas in children later on. Researchers who were at first scorned and later hailed as heroes. What makes Judy a dissident in this tradition, and what is the Semmelweis effect?
Well, the Semmelweis effect is that dynamic that you describe, where predominant medical orthodoxies are safeguarded ideologically in kind of a knee-jerk reaction by the medical community, and particularly the doctors and the kind of the medical cartel in the medical community tend to go immediately into a defense posture to defend things like, x-raying pregnant women, even long after the establishment between that procedure and cancers in those children is well established. The same thing happened with thalidomide. The same thing happened with calomel, which was a mercury-based tooth powder that was used for 100 years and was finally terminated in the 1950s. That was causing these devastating illnesses in children. DDT was another thing that the American Medical Association, because it had recommended DDT for the suppression of malaria, it was the last group to be willing to back off and say, yeah, there's a problem here, even when the science was well established. Ignaz Semmelweis was a Hungarian doctor at a time when more than half of the women who went into hospitals were dying for childbirth, were dying of puerperal fever, which was also known as birthbed fever. And he had an idea. This was before Pasteur, before germ theory, before anybody knew about germs, but he had an idea from his own anecdotal observations that the scientists who were the doctors, who were the same doctors who were performing autopsies, that they were not cleaning their hands between the autopsies and delivering babies, and that they were bringing some kind of toxic particle into the birthing rooms. And he did an experiment where he got them to wash their hands, and he dropped birthbed fever from around 50% mortalities, from around 50% to around 2% of the women who came to the hospitals. When he published on that, at first he was applauded. Then suddenly he was derided, and ultimately he was tricked into going into a mental institution and apparently murdered. And the medical associations at that time went against him with a vengeance, because it challenged their kind of deified position as physicians by saying something that you're doing, instead of helping patients, is actually hurting them. And that's part of the reason that we see this, this enormous reaction to any kind of criticism of vaccines. And of course, Judy's science was a devastating blow to them, because what Judy discovered, among many other things, what Judy discovered was that there was a virus that had been grown on mouse brain tissue. When you grow a vaccine, when you're making a vaccine, you grow them on animal tissues, on cocker spaniels, on mice, on pangolins, on bats, on horses, and on insects, and on human lung tissue from aborted fetuses. And that's how vaccines are made, most vaccines, or many vaccines. And Judy discovered a virus where she was assigned to work to look for the cause of chronic fatigue syndrome. Chronic fatigue syndrome was a devastating illness that appeared in an epidemic form in the 1980s, and it affected mainly women, and the medical community behaved reprehensibly. They dismissed the disease as a psychosomatic illness. It was at a time when women were first entering the job force at high positions in corporations. And they said this illness is because women are not biologically equipped to handle that kind of responsibility that was traditionally belonged to men, was a province of men. And that's why they're getting these psychosomatic breakdowns. And what Judy found when she actually started studying the disease for NIH was that the women who complained of chronic fatigue syndrome and had been diagnosed, 63% of them had a virus that she was able to find and identify and isolate that was called the XMRV virus. And that only 4% of the control group, so of healthy women, had that incident of that virus in their blood. She published on that, and NIH and Tony Fauci, who was her boss, was okay with her publishing about it because it didn't threaten any of their paradigms. Subsequently, Judy learned from work that she did and from work that other scientists were doing. And by the way, XMRV by then had already been associated with many other diseases, with leukemias and cancers and a lot of really bad illnesses. Very, very strong associations. And what Judy found out was that the source of the XMRV, not in the blood supply, was coming originally from a vaccine that had been made, a polio vaccine that had been made using mouse brain tissue, and it was a virus that was common in mice, and it had made the leap to human beings through vaccination. And now it was not only in that polio vaccine, it was in hepatitis A vaccine, it was in the MMR vaccine, and it had contaminated the entire blood supply. And that was something that Tony Fauci couldn't broach because it was essentially an attack on his industry. It was saying that the vaccines that NIH had blessed and anointed had been part of the approval process at FDA, had urged CDC to recommend and mandate for 74 million children annually. They had made a very, very bad mistake. And instead of saving lives, those vaccines were most likely to be causing more mortalities than they were averting. And that is a threat to the entire vaccine paradigm. And their only response to that threat was that Judy Mikovits had to be destroyed.
What are coronaviruses? And then why do you think this is a SARS-CoV-2 plus XMRV? What makes you think that in terms of the presentation of the illness?
Well, coronaviruses are RNA viruses, and they have, as we know, an envelope. You protect the nucleic acid by building a fatty acid protein envelope around it. It looks like that, little particle forms. So the RNA is the blueprint of the virus. And as I mentioned, retroviruses are a different blueprint, an RNA, DNA blueprint, just subtly different, but they're also envelope viruses. So when you do a test for polymerase chain reaction, what you're doing is you're taking a small piece, let's just say 10% of the blueprint, 150 base pairs out of 8,000, and you're amplifying it artificially in the lab and making millions of copies out of that one copy, and then you call it a positive. And so, as you know, the PCR tests that are being done now, you do a nasal swab or a throat swab and scrape the cells that the virus would infect, the epithelial cells, out of the nasal passages. That's where coronaviruses live. When you do that, it doesn't say an infectious virus at all. It just says a piece of RNA that in order to see it, you had to amplify a zillion times in that quick, short time period of the test. So that the serology testing actually says you've been infected because the virus got in your blood. you didn't have the degradation, the machinery in your nose, and you were susceptible, and you did, because of other infections, you actually got an infection that your immune system couldn't handle, and you made an antibody. And that's the principle of all vaccines. You give them the antigen in a low dose, and they make an immune response to it, an antibody, and then the next time they see the pathogen, they don't have to go through that 2-day process of make the antibodies, and the virus can't build enough of a reservoir, so you're immediately giving the antibody the next time it sees the pathogen. You don't get as sick, or maybe you don't get sick at all. So that is a vaccine strategy, and that's why I said the people that have the antibodies are already immune. They don't need to worry about a vaccine.
So let me just ask you that. They're saying that they're not sure if the people who have had this or have the antibodies are going to be immune. Doesn't that undermine the whole argument behind vaccination?
Exactly. And that is the only criteria of vaccination is, do you develop an antibody? It's propaganda masquerading as science. This isn't science. No, if you make an antibody, I've heard things like, well, the antibody testing says what an IgG means, that antibody family means a past infection. And that would help us to say that this virus has been in this country a lot longer than they say it's been in this country. And then the second thing is, if you make an IgM antibody, it's a recent or an acute infection. And then you're not necessarily immune, so you need to be protected in a way if you've been exposed recently. So now I'm hearing this, I'm seeing in the press and seeing people say, oh, the IgG antibody is a later stage of disease. And it's not a later stage of disease at all. It's immunity. So we're playing this word game, and we're using serology positive, which should say we've developed a herd immunity, and we've developed a population that can go back to work, because in fact they're going to protect the rest of us in the most vulnerable in the U.S. But now that science is being twisted to say it says something it doesn't say.
The media continues to report that we have no evidence that patients who survive coronavirus have immunity. I think actually the truth is the opposite. We have no evidence that survivors of coronavirus don't have immunity, and a great deal of evidence to suggest that they do. The question of immunity is linked to health policy, in that workers who have gained immunity can be a strong part of our economic recovery. The silver lining to so many infections in the meat processing industry is that a large portion of these workers now have immunity. Those workers should be reassured that they likely won't get it again, instead of being alarmed by media reports that there is no evidence of immunity. You've stated publicly that you'd bet it all that survivors of coronavirus have some form of immunity. Can you help set the record straight that the scientific record, as it is being accumulated, is supportive that infection with coronavirus likely leads to some form of immunity? Dr. Fauci.
Yep. Thank you for the question, Senator Paul. Yes, you're correct that I have said that given what we know about the recovery from viruses such as coronaviruses in general, or even any infectious disease with very few exceptions, that when you have antibody present, it very likely indicates a degree of protection.
What are your thoughts on lockdown as a method of dealing with an upper respiratory virus?
My thoughts are just, I'm horrified by it. It's crazy because we're not developing a natural immunity. We're making people sick in that we protect each other, but if people are healthy, they don't spread disease. And that's why I mentioned how many times in PCR you need to amplify that RNA. So a mask won't protect a 30 nanomolar piece of a viral particle from spreading through the mask. But the mask will amplify the viral reservoirs in the person it's in. So this is so the lockdown is crazy because we don't get a natural herd immunity. But more importantly, the mitigation that should have happened is interferon alpha and hydroxychloroquine. and the serology testing, all of which costs nothing, and the healthy people can stay working. Healthy people don't spread disease.
But we're constantly told that we are asymptomatic carriers, possibly. That's not true?
Asymptomatic carriers doesn't mean you're expressing virus. And the story I always use with that, sure, you're an asymptomatic carrier. There are millions of Americans right now who are asymptomatic carriers of HIV and XMRVs and many other viruses, influenza viruses, because we've been infected before. So we're asymptomatic carriers, but we're not spreading disease if we're not sick. And I say that, and I can say that with great confidence, because back in the 80s, the only time I ever isolated HIV from saliva were people on their deathbed. And when Frank Rossetti and Bernie Poise isolated adult T-cell leukemia virus, HTLV1, it was from the sickest of people with adult T-cell leukemia. So when you're all the way at the end of disease, when you're so sick, those are the people expressing the virus. So the sick people in the hospitals, and it's called nosocomial spread. You know, they should be protected, not with a mask, but given oxygen. And the nursing staff should be wearing the masks so that the hospital staff isn't exposed to large amounts of virus. Healthy people don't spread disease. So everything about the lockdowns prevents natural herd immunity from occurring, and it should have never happened. Everything should have been open yesterday, the day before, last week, because the evidence in this country by those serology tests and by anecdotal data is many people, at least that I talk to every day, say, I had that last November. I had that last summer. Oh yeah, that was the worst cough I ever get. But when I recovered, they're likely to have made antibodies, and some of those people we've looked at, they're actually neutralizing antibodies, means they can prevent infection in the most susceptible. So all of these measures cost nothing. And none of this shutdown need ever occur, because we could have protected people in the beginning with a simple, very low dose type 1 interferon spray and measures of hydroxychloroquine, which has been very safe, WHO essential medicine, for 70 years.
Can you just very briefly talk about what you've mentioned before, CO2? Can you just quickly talk about what are the dangers of wearing a mask if you are asymptomatic, if you're healthy?
So if you're wearing a mask and you're healthy, you're breathing in your own, bad air, your own toxic air. So back and forth through the day, it's very stressful to breathe in toxic air. You're not getting enough of fresh air and oxygen. And just the fact of wearing the mask is stressful, because it's hard to do if you've never been a professional doing that. You itch your face, it's wet, it's moisture, it's actually amplifying. It's immune suppressive. So you're damping down your own immune system, your type 1 interferons, and you're activating your dormant viruses. So other viruses from within yourself, you're activating such that now you're amplifying them because you're wearing a mask. You're not protecting anyone. And in fact, everybody's totally stressed out for all of the reasons they should be. That, the people aren't intended, it's an upper respiratory infection. We've known for at least a century just washing your hands for the medical professionals and protecting yourself from spreading it to healthy individuals. Healthy individuals rarely spread these things.
On the subject of masks, you made the claim that wearing them outside, I suppose, of acute clinical situations is unhelpful, that it literally activates your own virus. You're getting sick, you said, from your own reactivated coronavirus expressions. Science, the journal, claims to not know what you mean by that. Can you explain in more detail what you're suggesting?
So 8% of our of our genome is a virome. And that is all of the exposures that we've had, and we clear and we develop immune responses to. Many are latent, like herpes viruses, like those retroviruses. They're dormant. Your immune system has imbalance. They're not expressed. If you put on a mask and you're exercising and you're not breathing air, you're actually breathing CO2. You can become, it's called lactic acidosis. So you become acid and you're actually denying yourself oxygen, hypoxia, and then some. It's immune suppressive. It suppresses your very CD4 positive T cells, that adaptive memory immunity. So you activate the dormant because your memory was keeping those silent. And this is just, this isn't new. This isn't just me saying it. This is basic immunology, and they know it. Activate latent viruses, they cause disease. And the mask is immune suppressive, and that's clear. I don't deny that SARS-CoV-2 exists and is potentially a pathogenic, more pathogenic virus to the susceptible. But the people that were liberally called COVID-19 without the accurate test, if you haven't made an antibody, if you haven't seroconverted, according to your immune system, you haven't been exposed. RNA in your nose is not exposure. That's why the PCR test is a bad one. 80% of them were false positive. I can make that little piece of virus and pick out thousands of microbes out of your nasal passage. That's why you have an immune system. So people were sick because anybody that went in with a fever or coughing were called COVID-19. And notice how we don't have influenza this year. So it's known that the influenza vaccine over the last few years hasn't worked. It's not the right strain, whatever you want to say, but the government again says go get that vaccine anyway, and it's the vaccinated in 2 recent papers that are coming out that get the flu. And you shed that virus, so the vaccinating are shedding other upper respiratory infections, and you get a respiratory. So anything that was an upper respiratory infection was called COVID-19. And yes, this novel coronavirus, there's no question it's a novel coronavirus. If it got out, really the only driving force to send it through 190 countries in a matter of months is through sick people or the vaccinated, because they're shedding other types of viruses to cripple the immune system. So we do know that in Italy in January of 2019, they got that 4-component for influenza virus vaccine, which had never been used before. And those vaccines do kill the susceptible. And they do carry coronaviruses, and you would register as positive for the coronavirus and possibly the novel coronavirus, because again, the Vero E6 cell line was transported between Fort Detrick and Wuhan, China, and North Carolina and other places in the world, because that's the cell line we grow our polio vaccines, our other vaccines, and that's the one they use to grow these coronaviruses. So there's not just one virus somewhere, and we know there are many strains, and we're seeing those mutations in some countries where different susceptibilities and different environmental conditions, so pollution, cigarette smoking, high blood pressure, diabetes, being overweight. All of those things are risk factors. Now, those are the people getting the most severely, people with other inflammatory diseases, and that makes sense because inflammation, the flame, is that cytokine storm. So it's like you took that SARS-CoV-2 virus and it was throwing gasoline on a fire. If you throw gasoline on a healthy 20-year-old or on the grass out there, nothing happens because they don't have that fire. But then that little trigger is what we tend to say is the straw that broke the camel's back. Again, my husband's got COPD and he's a chronic obstructive pulmonary disease and he's 81 years old. So he's the one that is at risk every year of an upper respiratory infection. His COPD was driven by a bacterial infection he got as a young man. And so, but we always protect him. And the one thing we don't do since I met him is we never vaccinate him. Because you don't give somebody who's at risk of an upper respiratory infection driving a disease another upper respiratory infection. And that's what the vaccine strategy is. That's why there's nothing about any of the candidate vaccines except for the one I described earlier. And that's why they never work, because when you inject the blueprint, the RNA or DNA of that virus, or you use, I heard it said, oh, let's just repurpose our polio vaccines. I mean, a horror of horrors. I mean, there's nothing that makes sense in anything that's happening in a level, and it really has nothing to do with the administration in any way, because Tony Fauci stood next to Obama with Ebola of 14, Zika of 17, Bush with anthrax, Bill Clinton, swine flu, bird flu, pig flu. What are those? They're zoonoses. They're another animal virus that becomes a virus. Could be coronavirus, could be an influenza virus.
Are they more quickly evolved, man-made, man-evolved zoonoses? Those other ones, are they xenotransplantation as well?
They well could be, but they never ended up being much of anything in the population because we never took these kind of ridiculous draconian measures before. So we didn't lock down everything. In fact, the best story is, for what we're proposing, and many doctors around the world, good old-fashioned medicine and nutrition with, that our FDA and our CDC are stopping us from doing. The vitamin C, the zinc, the various nutritional products that we know work. If we did those, then we would stop the evolution of the viruses. And it gets to a can of worms we probably don't want to get to, because the FDA stopped the production of interferons for the use of preventing zoonosis of coronaviruses from animals 40 years ago. So we could have, and what do we do to our animals? Oh, we vaccinate them. So there's an awful lot going on here, but the fact of the matter is this is 40 years. This isn't one administration, and this is 40 years of a practice that's literally been controlled by an industry that has an interest in money, and Tony Fauci at the helm, frightening, if you will, presidents and populations that the next big pandemic is going to wipe out the world like the Spanish flu of 1918.